Okay, welcome to our final surgery today. This is a patient who has had a fusion before, and now he has adjacent segment disease below the fusion. He is from Texas, Houston, Texas. You could see the hardware, screws, rods, cage. And of course, we all know the problem with fusion is that you get adjacent segment disease. If you fuse a disc, the next ones above and below wear out. They start causing problems, pain. All right. So not easy to get through all the scar tissue, shot. But that's what we're trying to do at this point. Shot. All right, very good. We're going to get there eventually. Shot, AP. All right, getting closer. We're going through a hole that's already there in the spine. Natural opening. That way we don't have to make any more holes. Very nice. Very nice. We're just about there. We're passing the facet joint. Now his facet joints are full of arthritis. We're going to fix those next. You okay?
How you doing, my friend?
Reliable?
A little sleepy.
All right. AP? Give me an estimate.
2 minutes.
All right, Henry, I lied to you. We're going to do the DPR right now.
Copy that.
Shot. Jordan, you're cracking me up. How come you flipped this? You got to flip the image. We're on his right side. Shot. Yeah, thank you. All right. Shot. Too high. Shot. Is that it? Mm-hmm. So I know I'm heading for the pedicle. Shot. It looks pretty good, huh, Jordan? It should be right around there. A lot of arthritis. Shot. That feels better. Hard to tell. We're actually on, feels like could be on the TP. Give me some rotation. Not that, towards me. Unless you think that would work. I've got to be able to see if we're at the junction. Yep, shot. It looks pretty good. Yeah, let's numb it up. So we're going straight into our DPR. Our patient is still a little sleepy. We're going to wake him up in just a minute. A lot of scar tissue here. Shot. And that scar tissue is not causing pain, but it is going to impede my ability to do his surgery. I have to work around it. Shot. Getting closer there. That's feeling more like it. Got to find his transverse process, shot. A little bit north of it. And it's not going to be normal because he's had so much surgery done in this area that I've got to figure out a way to get through all the scar tissue from that prior surgery. Shot. All right. Making some progress. Shot. I'm going to get this guy. Shot. Shot. You can feel the metal. Shot. You can see we're right on the TP. I feel all the scar tissue. His facet is buried underneath all this scar tissue. Shot. 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 All right, that's one. Shot. Shot. You're definitely waking up for that one.
All right, my friend.
You're doing great. You awake? All right, you're doing fine. Yeah, I know, we're almost done. You're doing great. Just give me a second. Shot. Everything's okay, we're just... All right. Let's go back. Well, hold on. What do you think, Bernard? You can give me just a little? You're okay. Let's go back to a lateral view. All right, let's keep him awake. We good? You're okay. All right, what do we got to do? Drop it? So we've done our DPR on one side. Now we're getting ready to do the Deuk laser disc repair. Go ahead. Our patient has a fusion at L4-5. He told me it didn't help, and now I know where he's got a problem. It's right below the fusion, L5-S1. You can see we're in the disc below the fusion. You comfy? You better now?
You feeling better? Okay, sit down.
All right. You're fine. How bad is that on a scale of 1 to 10?
10?
What number did you say, sir?
8.
Is that where you get pain?
Yes.
All right, 8 over 10 at L5-S1, concordant. When you wake up, we'll be done with your surgery. So at this point, we got into the disc at 5-1, below his fusion. We tested it. It's under a lot of pressure from inflammation, and it's definitely causing his back pain. He said 8 out of 10 when we tested it. That's pretty good. So I'm going to go in there and fix that disc with the laser. When we're done, that pain will be gone. So definitely the disc was causing pain, and the facet joints are causing pain as well. We've already treated the facets at L5-S1 on the right side. Shot. Now we've got the left side to do. shot. A lot of scar tissue from his surgery. You all see the screws and rods? Now, I used to do those all the time, those fusions. And I could tell you that work up there is not bad. They did a pretty good job technically. But they didn't get rid of his pain because they didn't fix this disc as well. They should have done both discs, but they only did the one. If they had done both, then he wouldn't have this problem that he's having now. He wouldn't have to have a second surgery. That should be good. All right, we're going to go fix this disc. You're going to see there's a tear there that's causing his pain. Let's go ahead and run the video showing how an annular tear and a herniation can cause so much back pain. All right, welcome back. Now you see why people with disc problems like annular tear, herniation, why they have so much pain, because there's inflammation happening in that disc. And that's what we're here to fix right now. Right here, right now. We use the laser to do it. Just got to clean out the herniation, clean out the old inflammation, and that gets rid of the pain from the disc. Now, we've already done the DPR on the right side for the facet pain. Any questions so far?
No current questions.
All right. I can tell you right now, this disc is tough. It's all scarred up. But boy, is he going to feel good when this is over. I'm excited for him. How long has he had his back pain? 7 years. 7 years. So nice that somebody knows these numbers besides me. 7 years he's had back pain. 7 years of his life taken away from him. That's the way I see it. You know, having back pain every day, not being able to do the things you want to do because you're limited by pain. You're afraid to make the pain come on. You're taking pain pills. That's no way to live. And then to have a fusion surgery that doesn't even work because, well, they did a good job with the fusion, but didn't work. See that all the time. Fusion, not the solution. Part of the problem. Just made this disc worse. I don't mean a fusion can't work. If it's done properly, it can work. You guys see the herniation there, the blue stuff?
Yes, we do.
And all this is chronic inflammation. By the way, L5-S1 is the hardest disc to get to. If you do transforaminal surgery, it is the hardest disc to get to. Most surgeons won't even do it. They can't get to it, but we do it all the time here at Deuk Spine. Once in a while, maybe 1 out of 50 we won't be able to get, but the other 49 we can. Any questions?
No current questions.
Carrie, do you have any questions? You've been watching surgeries all day now. You see how small the incision is, how fast the surgery is. By the way, Carrie, you probably don't know this, but all the patients we've operated on so far are gone. They all went home. There's no hospitalization with this spine surgery. Does Carrie have any questions?
Yes, actually. So when you come into contact with customers, clients with this much scar tissue.
Wait. Tell Henry your question.
Yes.
You definitely don't have a DJ voice. I'm sorry. But you got to learn how to talk in the mic. It's not second nature. It's really, you got to enunciate and you got to slow down. I couldn't hear a word you said.
When you come across this much scar tissue, is it usually because of age or trauma?
Great question. So the scar tissue you're seeing, this entire white wall of scar tissue, all of this, that is scar tissue. That is from inflammation. So inflammation is your body attacking something. So this is years and years of inflammation. This is not even 7 years. This is more like 20 years of inflammation. Okay? So why is there so much inflammation in this disc? The answer is the tear and the herniation. You don't get inflammation if you don't have a tear. You don't get inflammation if you have a tear but you have no herniation. So there's got to be both a tear and the herniation to get the inflammation. And this is just like literally years of scar tissue piled up on top of itself. All from chronic inflammation. That's really what it is. All right, I got maybe 3 minutes left on this DLDR, and then we're going to zoom on over to the patient's left side and do his DPR for the facet pain on the left. Good question. By the way, the scar tissue itself is not the problem. It's a sign of a problem. You know what I mean? It's actually an indication that inflammation is going on here. But the scar tissue itself is not the problem. It's the herniation inside of it that's the problem. We could potentially leave the scar tissue if there was no herniation. You've got miles of scar tissue. All right. Just about done. All right, there we are. There's the end of the disc, the outside. Again, just chock full of scar tissue. And we know this was a painful disc. We tested it. He had 8 out of 10 pain. It was concordant, meaning it's his typical pain he has every day. That's what concordant means. You see the pink stuff right there? That's all inflammatory tissue. And just putting the final touches will be done here. We should be done with this whole surgery in 10 minutes. We were going to break this up into 2 surgeries, but since we didn't have that opportunity, we're just going to go with it. And this will be a combined DLDR, DPR. All right. Any more questions?
Yes, we have a question from Vitality Approach on YouTube.
Hello, Vitality Approach. Welcome back to our stream.
They asked, does a tear in the disc that is not touching the nerve ever just allow old debris toxin to off-gas into epidural space and onto the nerve? or does it just manifest as dysogenic pain?
Yeah, so if the annular tear and inflammation coming out of that tear is not near the nerve, yeah, it will not cause leg symptoms. You're right. The patient will just have back pain. So yes, it can off-gas into the epidural space, just away from the nerve, and not cause any leg symptoms. Very common. That's why, unfortunately, there's so many people out there, they have back pain, they go to their surgeon, and the surgeon says no surgery because you don't have any leg symptoms. So the surgeons are only looking for people with leg symptoms. Well, what about the people with back pain? They're ignoring them. They're sending them off to pain management. And of course, pain management's not going to fix anything because pain management doesn't have the tools to fix people. They only have the tools to treat pain and give some temporary relief at best, which is why coming in and getting this surgery done is the right thing to do because it's a cure. It literally will cure this disc problem for the rest of this patient's life. They won't have this pain anymore. And that's really what we're after is cures. Not treatments, but cures. I need it back. So if you want just temporary pain relief, take a pill, get a shot. But if you want permanent pain relief, come to Deuk Spine Institute. And that's what we do. You know, we give people permanent pain relief from whatever it is we're treating. Now we are going to do the other side, the DPR on his left. All right, let's go ahead and bring in the fluoro. Needle. Shot. So you're probably going to have to rotate, maybe a little bit. You can see the TP over there. It's not too bad. Shot. Uh-huh. He's got really wide transverse process and facet. Go to your side, please. That's a little better. Yes, so you can see the tip of the needle is like right where I need to be. It's pretty good. I wonder if I can do a little better. Shot. Can you get a, yeah, that's it right there. That's a pretty good shot right there, Jordan. I'd keep it there. You can see that I'm right over the spot. Yep, go ahead. Great. So. Holy macaroni. Holy macaroni. Shot. Shot. All right, I got to find my way back to that little spot there. Shot. That's pretty good. I could feel bone and it looks good there. If I could just get the, what are we on, 40?
Yes, sir.
Shot. Oh, it's perfect. Just have to sit here for a minute.
I talked to the engineer. They're gonna go over there probably tomorrow to take them the gas to
Oh, really?
Yeah.
So you know where they make these things?
No, I don't know where they make them, but I say I give you the code number and everything in that case they can actually have information.
Right.
Yeah, so, yeah.
But where is the company? It's in Melbourne?
Oh yeah, it's like a 5 minutes from here. It's literally like a.
Let's get a new tip.
Can I have another chip, please?
No, I want to replace the tip. I'm not happy with it. What is that mess there? Let's. It seems like there's just a lot of dye artifact. You see that, Jordan? Yeah, all through there. It's obscuring the facet for the next level down. Any other questions?
Yes, this next question comes from Vitality Approach, once more on YouTube. And they asked, what amount of osteophyte complex is deemed as necessary for you to remove based on what you can see through the scope?
We can remove osteophyte complexes through the scope. We've never not been able to remove what we need to remove to treat the patient properly and completely. So what I'm saying is most osteophyte complexes do not need to be removed. Sean? They're not causing symptoms. So we don't do things just for the sake of doing them. We do them because we're trying to help the patient get better. And Sean? And we want to avoid doing things that don't make the patient better. Shot? For example, removing every osteophyte complex in your body is not going to make you better. Removing one strategically will. A lot of scar tissue here from his prior surgery. It's just really wreaking havoc. Let me have the knife. Shot? All right, I got to see that TP better, Jordan. Shot? All right, let me try. Going a little more south. Shot? Shot? I don't know if I can get any better than that. Just about done, my friend. You're doing great. It's right where his pain is. Shot?
We have a comment or seeking
Let's
for.
go south a little bit. Yes.
This comes from Jesus on YouTube.
Shot? I think we're done. Yes, Jesus.
They said, hello, my name is Jesus. I had a laminectomy done 5 years ago with New Mexico Orthopedics, and I'm always in pain. Again, very much in pain. How can I contact you, please? You can send us your MRI.
Thank you.
And we'll review it and see if you're a candidate, which you should be. We just need to figure out what you're a candidate for. Good job, everybody. Will you put the link for him?
Already done.
All right, so we fixed his disc and we fixed his facets, both. And he had pain from both of them. So we had a lot of people today with pain from both facet and disc. EBL 1.5 mil. Scopius was a 3. And if there's no more questions, we can end the broadcast.
Copy that.